there's a disproportionate effect of this health care on minority groups in the country. Very disproportionate. Neighborhood and housing policies. Affordable housing. There's an article in the Gazette. What you look for, you will find. There's several articles that, because of where I'm at, I pick up on the titles. Talks about a shelter shortage. House of Mercy in Janesville. They have more people. The demand is higher than what they can meet. So high that they've cut back. You get 30 days of transitional housing there. They used to have a 3-week extension. They've stopped the 3-week extension, even though their own statistics show that that 3-week extension is usually enough time for many of the people to get placed in a more permanent housing arrangement. Affordable housing. The poor, many times, live in neighborhoods that are closer to industrial areas, and some of this information comes from a government accountability office report that was presented to the, I believe, to the Senate. People that live in those neighborhoods are exposed to more environmental hazards. They develop more health-related issues because of where they live, which is influenced by education. Also, public safety. There's some neighborhoods that I wouldn't want to necessarily walk in. Some neighborhoods, it's dangerous to do that. Healthcare is in the center of this picture because of all of the interrelationships. Also, it's the largest budget item in our society. And it's impacted, like I said, impacted by other policies, but healthcare in America negatively impacts the hands that feed all of us, and that's employment. Because U.S. companies, this is a global economy now. You have multinational and transnational companies that that compete in the world market. U.S. producers of goods and services, the ones that offer health insurance, that is part of their cost. So they have to find other ways to offset those costs. One of those is increases in productivity, which many times means using less people and putting more work on the people that they have in order to be able to compete on the global market.
Just to get this straight, so like countries where the government provides health care, the corporations don't have to pay that cost then.
Right.
And then they don't make the workers work harder just because they have to go to health care more.
Right. Right. So we've got a number of what I call negative synergies associated with a whole group of public policies. And I advocate for the fact that in order to unravel this, it's going to take development of what I call, this is the beginnings of what's known as a process map, but it's going to take development of a process map at the government level, because there is a lot of waste on government programs. One example is, and I'm not sure if this is still true today, but a number of years ago, there were 84 different departments of state and federal governments that governed the distribution of food. 84 different departments, each with 84 different administrators, with staff. It's very, very fragmented. And it's costing each one of us 81 million uninsured and underinsured. That counts the underinsured. And underinsured is you have health insurance, but you still can't afford to get the health care.
You're talking about waste. I saline solution, which is a simple saltwater solution, or it has to be sterile. And I've been getting it on a prescription, paying up to $45 for these liters. And my insurance in Florida now pays for it all, and I get little tiny bottles, and it's wasteful, I think. But anyhow, they don't get the liter bottles. But anyhow, I ran out. My prescription ran out, so I had to get some saline. So I went to a pharmacy. I didn't have a prescription. I had to have a prescription. So I called my doctor. He faxed up a prescription, and I got it for $15 a liter. Okay? I went to another pharmacy. I saw it on the shelf. Same thing. $5.25 for a liter. Now, what do you suppose the insurance is paying for that? They're not paying $5. They're paying $15 and charging everybody else $20.
Yeah, it gets convoluted, because many times you will pay your copay for drugs when you have insurance will be higher than what you can buy the drug for if you don't have insurance. A lot of this comes from personal knowledge. One of the other things that I find really disturbing to me is that hospice care came into being so that you could be comfortable when you're dying. It's my understanding that there are some hospice patients that are turned away from hospice because they don't have the money to get hospice care. So even in this country, money determines whether or not you can die in comfort. What are the costs? There's something known as an opportunity cost. And an opportunity cost is what if you choose a certain path, or a company chooses to sell a certain product, what are they losing by choosing that one and compared to the next best alternative? Opportunity cost in the healthcare industry starts coming into unpaid compensation of caregivers. $76 billion is what economists figure that people in this country provide uncompensated care to their loved ones. That's the value that they place on it. Now that uncompensated care many times puts stress on those caregivers. They have to try and get off from work to go someplace. They're balancing this work-life thing, and if they ask for too much time off from work, they might lose their job and lose their own benefits. That's an opportunity cost, and it's huge in this country. There's moral cost, human cost. I already went over the cost of society. Society is only as strong as its weakest link. If we increase that weakest link, there is a very real possibility that everybody loses. There's a lot of smart people that have written about this. What you look for, you will find. A lot of people think that it can't happen in America. We had a civil war. We're more divided now than what we were before the Civil War started. What you see in Washington, what you see in Madison, is a reflection of that division. The politicians are reacting to the support that they get out in the country. What you're seeing there is a mirror of the division among people in America. These are the excess administrative costs because of the paperwork and because of the paperwork. That $190 billion would provide enough money to provide access to health care for all people. These costs suggest that we need to be looking at a single payer system. That does not necessarily mean socialized medicine. But if you go all the way back to that opening clip with the auto insurance is a form of social insurance. It's a form of social insurance. Homeowners policies are a form of social insurance. Everybody pays for those that suffer a loss. Medicare is social insurance.
Isn't that what the early church did?
So, changing the landscape, oh, I'm way out of time. Whoa, somebody should have picked me. I guess I'm gonna have to finish next week, but this is a passage that really struck me, and I won't read through it, because there's many things in that passage that are reflected in the past 3 weeks of what I've been talking about. And I really feel that when you get to the highlighted section, that's one of the main problems that we have with policies in America. We are in love with money. Amen. Sorry about going over. Have you got any questions?
How we do this?